When someone mentions the country England, what comes to your mind first? Is it the royal family? Wimbledon? Maybe even the Big Ben. Although all of these things do represent England and are often the first things thought of by many Americans, England has something much more important that Americans should be aware of. By this, we mean England's healthcare system. First, let's go through some key information about England's healthcare system. England has a government-sponsored universal healthcare system called the National Health Service, abbreviated NHS. The National Health Service is a program that covers England, Scotland, and Wales. Citizens are entitled to healthcare under this system, but also have the option to buy private insurance as well. Coverage is universal, meaning that all residents of England are automatically entitled to NHS care, typically free at point of use. Point of use just means at the moment they are receiving care. Non-residents are also offered largely free care at point of use under the European Health Insurance Card. In England, private insurance offers faster and more convenient access to care, specifically for elective procedures in the hospital. However, private insurance is usually accessed through employer groups, or more rarely, by wealthier individuals who want more benefits and seek out private insurance carriers directly. While speaking of the National Health Services, it is also important to mention the National Institute for Health and Care Excellence, also known as NICE. The goal of NICE is to improve the health outcomes of those using the NHS and other public health and social services. The NICE guidelines are evidence-based recommendations for health and care in England. The guidelines decide which care and services are suitable for most people with a specific condition or people in specific situations and settings. The goal of the guidelines is to help prevent ill health, promote and protect good health, and improve the quality of care and services. In general, healthcare in England is funded by general taxation. About 18% of a citizen's income tax goes towards healthcare, which is about 4.5% of the average citizen's income. The government owns the majority of the hospitals, pays the doctors, buys the medicine, and covers the bills. This is the closest thing to our view of socialized medicine in the United States. Because it is a limited pool of money covering a large group of people, there has to be regulations put into place to decide what is covered and what is not. As I stated before, this is where NICE comes in to aid the NHS in controlling the budget through controlling the range of medications, tests, and procedures they will pay for. Something unique about England's healthcare system is the pay-for-performance aspect. Oftentimes, the British Medical Association agrees to give bonuses to the doctors who are performing the best for specific treatments. This provides doctors with an incentive to give the best care they can at no extra cost to their patients. This type of model promotes quality care because the competition is not between the insurance companies charging more money to receive care, but the competition is between the doctors to provide the absolute best care to their patients they can. Most general practitioners are employed by the government and work in government-funded hospitals, so individuals covered by the NHS will have access to whoever they want to see. However, England does have a gatekeeper model, where you must get a consultant from a general practitioner first before getting to see a specialist. This differs from somewhere like France that has an unfettered physician access, meaning that they can go straight to a specialist, such as a dermatologist, if they believe they need to see a specialist. There are some private doctors as well that individuals can be granted access to see through the purchase of private insurance themselves. Private care only makes up about 3% of Britain, though. They charge their own fees, whereas general practitioners get their fees paid by the NHS. The overall culture of England is not outstandingly different from what we see here in the United States. However, there are some subtle differences in the way they approach healthcare. There is a large emphasis on emotional and mental health in England, as it is estimated over 10 million people have a mental health condition, according to the King's Fund Centre for Mental Health. England is also known for its very caring and attentive nursing system. Thanks to Florence Nightingale and the foundation of the St. Thomas' Hospital, the first nursing school, England considers nursing to be a very prestigious and important career. Finally, their culture influences the food they eat, which in turn has an effect on their health. Their unhealthy habits, such as their high-calorie meals, snacks at tea times, and an abundance of alcohol consumption, have all led to an obesity rate that has begun to increase alongside the United States.
To become a doctor in England, there are steps that must be taken. You must have a medical degree, which usually takes about 4 years. There is a 2-year foundation program after medical school is finished. The license to practice is given in the first year, and after completion of the first year, full registration is given. If you already have a degree, graduate programs are offered. This is the same degree as other medical degrees given. In order to become a specialist, 3 to 7 years of training is required. A disclosure and barring service check is needed as well. As far as cost goes in medical school, there is a cap of €9,250, which is around 10,241 US dollars for 1 year of medical school. At the University of Kentucky, the cost of medical school is $40,396 per year for in-state students. There is a huge difference in the cost of medical school between the United States and Great Britain. Overall, citizens of Britain have better health than United States citizens. Britain has a lower child mortality rate than the United States, and they have healthier and longer lifespans than the United States. People of Britain have more improved recovery rates for major diseases than people in the U.S. In Britain, there is a long wait list, but there are no bills for patients to pay. The NHS doesn't pay for physicals, so they're not part of a routine testing, and Britain's doctors are more hesitant to give surgeries than the U.S. doctors. Britain's doctors also do less surgeries and provide fewer medications than doctors of the United States. Some other interesting statistics are that there is a lower probability of dying under 5 and a lower probability of dying between 15 to 60 years old in Great Britain than in the United States.
Hi, my name is Lauren, and with me today I have Natalia. And Natalia, where in England are you from?
I'm from Woking, England, which is about 15 minutes outside of London.
Gotcha. Are there any cultural aspects unique to the area you grew up in, or England in general, that you think might influence the people's health?
Yes, absolutely. There are a lot of pubs in England which are actually family friendly, so it's something that the whole family goes to, and as a result, drinking is a big part of British culture, and it's not really discouraged, so that can affect health. And also the foods at pubs aren't very healthy. It's things like fish and chips and fried things.
Gotcha. What is a typical doctor's visit like in England?
They take a long time to get into the doctor. My grandma is talking about this right now. She has a lot of pain in her back, but she won't even bother going into the doctor because it will take her over a month to get in there, which is a shame.
So what are the differences you notice between healthcare in the United States versus healthcare in England?
I think in the United States, the medical care that you receive is better, and there's a lot more things available, whereas in England, the care is better. The nurses spend more time like helping you shower, helping you get out of bed, things like that, but there's less things available. For example, I had the chickenpox twice as a child because they just don't vaccinate kids over there for that, just things like that.
So last question, are there any aspects of England's healthcare that you do wish were implemented here in the United States?
Definitely the care, I think, is better in England. My mom was actually a nurse in Britain, and she complained when she had a surgery here in America that the care wasn't as good as she was trained to give to her patients.
Well, thank you so much for being here today.
Thank you for having me.